Dear friends, today we will discuss on non-communicable diseases, diabetes. Diabetes, its causative agent, prevention, care and control. So let us start with the non-communicable disease. Non-communicable disease is a disease caused due to multiple causes and are not passed or transmitted directly or indirectly from person to another by any agency. For example, cancer, hypertension, diabetes, etc. Non-communicable diseases (NCDs) is a diseases which are not passed from person to another. Non-communicable disease, for example, cardiovascular disease, diabetes mellitus, chronic obstructive pulmonary disease, that is a COPD, and cancer. There are various risk factors, for example, high blood pressure, physical inactivity, obesity, raised cholesterol level in the body, decreased consumption of vegetable and fruit intake, raised blood glucose level, alcohol consumption, as well as use of tobacco. So friends, obesity is a major risk factor for a various type of the disease. Obesity, it causes the hypertension, sleep apnea, arthritis, cardiovascular disease, and in hyperlipidemia, insulin resistant hyperinsulinemia, which causes the cardiovascular disease also, and diabetes, diabetic complication, and the major risk factor, that is a social disability. So let us start with the diabetes. Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin, a hormone that regulates blood sugar, or alternatively, when the body cannot effectively use the insulin it produces. The overall risk of dying among people with diabetes is at least double the risk of their peers without diabetes. Diabetes health implications include elevated blood sugar is a common effect of uncontrolled diabetes and over time can damage the heart, blood vessel, eye, kidneys and nerves. Some health complication from diabetes includes diabetic retinopathy where optic nerve are damaged, diabetic neuropathy where neurons are damaged, and diabetes is among the leading causes of kidney failure also. 10 to 20% of people with diabetes die of kidney failure. Diabetes increases the risk of heart disease and stroke. 50% of the people with diabetes die of cardiovascular disease, primarily heart disease and stroke. There are the prevention of diabetes includes without urgent action, diabetes related death will increase by more than 50% in the next 10 years. To help prevent type 2 diabetes and its complication, people should achieve and maintain healthy body weight, be physically active, at least 30 minutes of regular moderate intensity activity on most days. Early diagnosis can be accomplished through relatively inexpensive blood testing. Treatment of diabetes involve lowering blood sugar and the level of other known risk factors that damage blood vessels. Tobacco cessation is also important to avoid complications. How to control the diabetes? There are two type of diabetes, type 1 and type 2. Type 1 diabetes require insulin, whereas type 2 diabetes can be treated with the oral medication or the oral hypoglycemic agents, but may also require insulin sometime as per the need of the patient. So, blood pressure control, foot care, and other cost saving intervention includes screening and treatment for retinopathy, which causes blindness, also, blood lipid control to regulate cholesterol level, and screening for early sign of diabetic related kidney disease and treatment. So, friends, these measures should be supported by a healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco consumption. So this is of all about the diabetes. It's a curable disease, can be cured by the oral hypoglycemic agents as well as dependent on the insulin. So supporting treatment is required for the diabetes as well as the some nourishment as well as the multivitamins should be continuously taken with the oral hypoglycemic agents. So any doubt or any query, you are feel free to ask anytime. Thank you. Have a good day.